Well, hi everyone. I'm Charlotte Edwardson. I'm the editor for the Journal for the Measurement of Physical Behaviour, which is the official journal for ISMPB. So today's symposium presentations are aligned to the special issue topic that we've currently got open in the journal, and you can see the title on the screen here. So just before we get into today's programme, I just wanted to give a very brief background as to why we're focusing on this topic and how today's presentations align to the topics within the special issue. Over the past 2 decades, there's been a significant increase in the number of studies that are using accelerometers to assess physical activity, but also more recently, the 24-hour physical behaviour profile. But synthesising the findings across these studies is challenging due to the significant methodological variability, and you heard a bit about this yesterday. And just to give you a couple of examples of this, so in the review published by Richard Pulsford in 2023, they looked at observational studies which had device-assessed physical behaviours. And within the review, they had 95 studies. And across these 95 studies, there were 22 different device brands used. In the same review, they also, across these studies, had accelerometers in various different locations across the body. So 6 different locations, with the main one being the waist, followed by the wrist, the chest, the thigh, the upper arm, and the back. And some studies had multiple locations. But beyond where location and device brand, there are also differences in device specifications, validation procedures, and also algorithms as well. The reporting of accelerometer methods has improved in publications, but there's still lots of inconsistencies. So this really makes comparability and generalizability challenging. So in order to advance the field, we really need to understand how these differences impact on levels and patterns of physical behaviours, and also then the associations with health. And it's really also important to determine how these outcomes can be rendered comparable. And that's really what this special issue aims to do. It aims to consolidate the evidence in this area. And within the special issue, we've outlined 4 topic areas, and 3 of those topic areas are presented or represented with the presentations that you'll hear today. So the first area is around reporting standards and transparency, and Grace and Marco will tell you about the research that they've been doing in this area. The second area is the impact of methodological heterogeneity on levels and patterns of physical behaviours and associations with health. And Alex and Jonah will tell you about a research study that we've been doing at the University of Leicester, where we've asked participants to wear 8 accelerometers across different locations of the body. And they will be presenting specifically at the implications of this on daily step counting. And the final area is around exploring the potential for harmonisation. And we've got 3 short presentations from Ben, Kirsten and Julian, looking at harmonisation of video observational methods and device-based measures. So as you can see, we've got a fantastic programme of presentations for you today. After Alex and Jonah's presentation, we'll have 2 short presentations from the sponsors. And then after each block of presentations, we'll hopefully have some time for a couple of questions. So if you do have any questions, please use the Q&A function at the bottom of your screen to ask any questions and make it clear who your question is aimed at. Okay, so that's all from me. So we'll get started with the presentations. So I will hand you over to Grace, who will be followed by Marco, and then we'll stop for a Q&A.
All right. Hopefully you are all seeing my slides.
Yes.
Okay.
Yeah, perfect.
So thank you, Charlotte, for the introduction and giving a bit of background that perfectly leads into what I'm going to talk about today. And thank you for the invitation to speak as well. So as we just heard, accelerometers are widely used to assess physical activity, sedentary behaviour and sleep in research and clinical trials. But inconsistent reporting of key information such as device specifications, device settings, data processing methods, analytic decisions that have important implications on the resulting outcomes or variables, metrics. limits the transparency, the comparability and reproducibility of research. So our study aims to develop consensus-based reporting guidance to standardise and improve accelerometry reporting. So the project is being carried out in several different phases, which follow the Equator Network's framework for developing reporting guidelines. So we started off with a scoping review to identify all existing reporting recommendations, and we used this to draft a proposed checklist of reporting items. We then ran an online Delphi survey where we invited experts and stakeholders to rate the importance of our proposed items and identify which ones should be considered essential to report. We are just about to host a consensus meeting where the project group and a smaller number of stakeholders will come together, and we will discuss and agree on the final list of items. And then finally, after a pilot to check the checklist, test the checklist for its usability, we plan to try and widely disseminate our reporting guidance. So I'll just give a super quick overview of the scoping review, which has recently been published. We identified a total of 47 publications, and from those we extracted 124 unique items of reporting guidance. So we then thematically synthesized those items according to the typical order of how you would handle accelerometer data in research. So the first theme was data collection, and this covered things like details of the device used, the wear protocol, device settings, and there was really quite strong agreement across studies that these pieces of information are important to report. The second theme related to data management and initial processing. So this included things like definitions of what constitutes a valid day, how non-wear missing data are identified and handled, and data reduction methods. And again, this was fairly consistent across the different studies that we included. The third theme focused on deriving the movement behavior, so how you go from the pre-processed data to extracting the key metrics. So what algorithms were applied, what software was used. And then finally, the last theme was summary metrics. And this one included, studies might have said if you're using accelerometry, you should report these metrics. And in this, we saw the least amount of consistency across the studies, and it tended to be more related to specific study designs. So if it was like a sleep-related study, then you tended to be a more consistent list of sleep metrics that should be reported. So apart from one item, which was making data and code publicly available, we didn't carry these summary metrics forward into the Delphi. And our reasoning behind this was that we think that it's probably better addressed through a core outcome set. And we also believe that as long as themes 1 to 3 are reported transparently, consistently, it matters less which specific metrics are reported, because at least we know how they were derived, and then this can be replicated. So going forwards into the Delphi survey, so we discussed as a team the list of items that we extracted from the review, and then refined this into a list of 52 reporting items that we took forward into the Delphi. We ran the Delphi using Delphi Manager, which is a purpose-built system developed by the Comet Initiative. And we had a 2-stage process. So in round 1, participants rated the importance of each item on a 9-point scale, where 1 to 3 means not important, and then at the other end, 7 to 9 means critical to include. And in round 1, participants could also provide qualitative feedback on each item, and they also had the opportunity to suggest additional items that they thought might have been missing. In round 2, participants were then shown a summary of the group responses with percentages alongside their own previous score, which was highlighted in yellow, as you can see here on the snapshot. And they were asked to reflect on how their views aligned with the wider group and then re-rate each item. And this is a key feature of the Delphi methodology. We set our consensus threshold at 70% agreement. So if at least 70% of participants rated an item as critical, it was considered to have reached consensus and would be included in the final checklist. And then similarly, if it was 70% rated it as not important, then it was excluded. So we had a really diverse and engaged group of participants in the Delphi. Participants represented more than 25 different countries, and they brought a range of perspectives and different roles as well. So many participants had more than one role, and the majority were academic researchers, but we also had participants who were clinicians, journal editors, funding panel members, and some device manufacturers as well. So out of 158 people that registered interest in participating, 122 went on to register on the Delphi Manager platform. We then had 111 people completed round 1 and 93 completed round 2, which is quite a good retention rate for a multi-stage Delphi study. So for the items, in round 1, 34 reached consensus for inclusion. Participants did suggest a few new items, and in most cases, we felt that they were quite similar to items that we already had included in our list. So we merged these items into the help text or into the text of the main item, but we did take forward one additional new item. We also used the feedback from round 1 to try and refine the wording of some items a little bit, just to make sure that the clarity and the understanding was at its best. And so in round 2, a further 7 items reached consensus, and that left us with 11 items that didn't meet the consensus threshold, either to include or exclude. And one of the things that was really nice was that participants took the time to leave us some really encouraging notes at the end of the survey. It was really nice to see that people were thanking us and just saying how important that they think this piece of work is. So I didn't want to bore everyone by going through the whole list of all the items, so I've just picked out a few examples of items that did and didn't reach consensus. The items that did reach consensus, perhaps the kind of things that you'd expect, so key details like the device brand, placement of the device, data reduction. And there was really strong agreement from the participants that these are essential to report for transparency and reproducibility. I think one interesting area, in my opinion, that didn't reach consensus was around the data and the code sharing. And there was a mixture of feedback left on this item as well. So some participants really strongly supported it and saying that it's essential for staying in line with open access principles. Others thought maybe it was useful but not essential, and then others have said maybe it's too broad because we've put together data sharing and code, that they could potentially have different implications. So I think this one's going to be an interesting one to have a bit more of an in-depth discussion about in the consensus meeting. So next steps. we're actually having our consensus meeting tomorrow, which is really exciting. In this meeting, we are going to focus on making final decisions on the 11 remaining items that didn't reach consensus. We're also planning to have a bit of discussion about how the final checklist should be structured and presented, so that we can make it as easy as possible to use. And then have a bit of a discussion about dissemination plans. And once we have that final checklist ready, we really want to have some pilot testing before dissemination, just to double check that it's practical and just identify any final refinements that might be needed. So we'd love for people to get involved in that step. So if you are working on an accelerometry project and you're in the writing up phase, and you'd be willing to pilot the checklist, please do get in touch if you'd like to help us out. So our aim is to generate a checklist that's practical, something that researchers will actually want to use, something to help editors and peer reviewers as well, and something that's flexible for different applications. But ultimately, if we can make good reporting easier, studies that use accelerometry can be more transparent, more comparable, and ultimately makes the research more useful. So our final outputs, we will obviously be publishing the reporting checklist, and we're planning to publish this with an accompanying explanation and elaboration document. And this will go into a lot more detail about the rationale for each item. It will provide some definitions and examples of good reporting practice. So I just want to finish by saying a massive thank you to our collaborators, and of course a huge thank you to Delphi participants and the consensus meetings for their valuable contributions and time. And thank you all for listening.